Thank you.
Good to see you. You're looking good.
Thank you.
Looking after yourselves and also looking after the women of this country. How's the Greater Accra Regional Hospital?
Good.
Yeah?
Very good.
Very, very good, Dan.
Yes.
Are you still in the same place or you've moved to newer premises?
No, we are in our old block.
Your old block,
Yes.
but still doing good work.
Yes.
Right. January is upon us. Cervical cancer, some say cervical cancer. Right. Awareness, screening, detection, and treatment. Let's kick off by just going over what cervical cancer is. It's one of the most common gynecological malignancies, if I use the big brothel. Yeah. After breast cancer is the leading cause of cancer amongst women. But let's share with our listeners, what is cervical cancer?
Good afternoon to your listeners and good afternoon to Greater Accra Regional Hospital, our director who is helping us a lot, and my team members.
Mm-hmm.
Thank you very much. Yes, when it comes to cervical cancer, we are all very passionate. At least the people or those of us working in that unit are very passionate about the word cervical cancer.
Right.
Because it is a preventable condition or disease. And like you said, after the breast cancer, the next one that is very bothers women a lot, right, is the cervical cancer. Because if you're a woman and you have an uterus or a womb, then it means you have a cervix.
Okay.
And this cervix does a lot of work, and we need to take good care of it. So cancer of the cervix is simply cervical cancer.
Right.
So the part of the womb that protrudes into the vagina of the woman is the cervix. And I have a picture, or I have a model here,
right,
which I would say, so the top here is the womb.
For those of you following us on Facebook and online, you should be able to see this, right? Okay.
And then the cervix is the one here with the hole at the tip.
Okay.
So it feels like the tip of your nose or a woman's nose. Once you put your finger in the vagina,
right,
which we are discouraging women from doing.
Okay.
When you put your finger in the vagina, you touch something soft. Not very soft, but then it feels like the tip of your nose. Mm-hmm. And this cervix does a lot of work. Like I said before, it helps to receive the sperm into the womb to go up to the fallopian tubes up there,
right,
to help in fertilization.
Okay.
And then it helps the menstrual flow to come out. Mm-hmm. It also opens up for the baby to be delivered when it's time to deliver the baby.
Right.
So this cervix has a lot of work to do, and we need to take good care of it.
Okay, great. I hope you've understood that and you're starting to digest it. But then, Elizabeth, let me ask you. So what would cause irregular malignant cell growth or cancer in this very important organ or reproductive organ? What would cause it to go wrong? We have an understanding that when the cells are doing the wrong things, literally by themselves, then we're talking of cancer. But we're talking of cancer of the cervix. What would, predispose a woman's cervix to this kind of disease condition?
Okay, thank you. The human body is made up of cells.
Right.
So when the cells around the cervix start develop or growing abnormally, then that is when we say that the cervix is diseased.
Right.
So the cervix has its normal way of developing.
Mm-hmm.
So when it starts growing abnormally, then there is cancer.
Okay.
But normally there's a virus that normally causes the cancer.
Right.
But it's not the abnormal growth, but a virus that causes the cancer. And this virus is normally sexually related.
Right. Okay. So we're referring to the HPV virus.
The HPV virus.
Okay. So a woman who has been exposed to this virus, then is more likely to develop this condition. Right. Okay. So you mentioned something very significant, and sometimes people leave this out when we're doing the cervical cancer or cervical cancer education and awareness, that therefore it is considered sexually transmitted.
Right.
Doris, sometimes people just go into the education and the awareness, and we drop this part, and there's should I say, a critical determining factor when it comes to cervical cancer: the number of partners you've had, the how early you started sexual activity, and all of these things. Can we talk a bit about that to firmly emphasize on this mode of transmission?
Thank you. So, like you're saying, rightly said, the HPV or human papilloma virus.
Right.
So it is a virus,
Okay.
and we know how viruses behave. So if a man has, so this virus can be found in men and women who are infected.
Okay.
In that pubic area, that is the lower part of the body, that's
Right.
where the sex issues come up.
Okay.
So if a man can be infected and infect a woman. And
So hang on, a man can carry the HPV virus,
Yes.
right? But he does not have a cervix.
so he will not be affected.
Okay, right.
So this man maybe had it from a woman or a man.
All right.
Then he keeps the virus and transmits it to a woman when
Okay.
they have unprotected sex.
Okay.
And even the protection during sex is not even very, very accurate.
It's not
because
100%.
It's not 100%.
Right.
Because the male condom will just cover the male penis.
Okay.
And this virus can be found in the other parts of the pubic area where the hair is grown
Okay.
around the scrotal area and all that
Right.
place. And when a woman is also infected with the virus, this virus can be all around the place.
Okay.
So when the skin to skin contacts come in, then the man will pick, or the woman will transmit it to the woman.
Okay.
And then another person to another person and to another person.
Okay.
So we say it is sexually transmitted.
Right.
Sometimes someone was asking, if we don't have penetrative sex, let's say the penis and then the vagina, will the person still have it? Yes. That's rubbing if the person has what we call warts, which is also HPV.
Genital warts.
Genital warts.
Which are
Then
also caused by another strain of the HPV.
of the HPV.
Right.
And we have the type 6 and 11, which causes the warts. 16 and 18, which causes the cervical cancer.
Right.
So we call what the causes are. The cause is actually HPV.
Right.
And it has to be sexually transmitted.
Okay.
So the other high risk factors, like you are saying, age before the beginning of sex.
Right.
So if a girl or a woman has sex before the age of 20, and these days, what do we see?
Right.
12, 13, 14 who are into sex. Then multiple sexual partners. So
Right.
if a man has
The
ever
longer
had,
you are on the road, the more likely it is
exactly,
that you have several partners.
Yes.
Or quite a few.
yes.
Right.
So, like I always say, whenever a woman, opens up her legs for the first sex, then you may be open to cervical cancer.
Okay.
And then smoking, women who smoke a lot, and then the family history where your mom had cervical cancer. Those ladies that she has delivered have a higher risk than someone whose mother did not have cancer.
Okay.
And then the things we put into the vagina to tighten the place for men to enjoy.
Right.
You know, once we put, someone was saying that they do cook food in the vagina. It was a bit, on the other side. But
Right.
then, truly, women like to put a lot of things in the vagina, which
Really?
is not too good. The ginger, the pepper, and all garlic and all
You're
sorts
kidding
of
me.
things.
People are inserting
Yes.
ginger.
Ginger, yes.
What for what?
For whatever reason, they will tell you it tightens or it kills the sore in quotes, whatever they do to
How
it.
does this predispose you or increase the likelihood that you may get the HPV virus or cervical cancer?
That will not cause it. But then, once you put these things there, there may be erosion because
Right.
they are harsh.
Okay.
And the normal vaginal flora
So that
keeps the place, in a certain state.
Right.
So once you put these harsh things there, then you are likely to leave the place raw.
Okay.
So when this virus, which is maybe up there,
It makes it conducive for the virus.
exactly.
Okie dokie. 22
then-
minutes past the hour of 2. Let me give Doris a breather, especially when she's talking about things that women insert that may predispose them to various complications. One of them may be eventually or ultimately cervical cancer. That's what we're talking about on Ultimate Health on Joy 99.7 FM this afternoon. We're live, I believe, on Facebook. YouTube, we're having a few headaches. But I believe on online platforms, you can also listen to the live stream. Telephone at WhatsApp is 055 11 11 997. Shortly, I will activate the phone line so you can ask questions of my guests who are from the Greater Accra Regional Hospital. Doris Agyei is the DDNS, Deputy Director of Nursing Services. You're still Deputy?
Yes.
Oh, achoo. All right, I'm campaigning. And next to her, Senior Midwifery Officer Elizabeth Agyei. They're with the team there, great team they have, and several great teams across the country, actively raising awareness and delivering services to women. Not just with regard to cervical cancer, but we do focus and emphasize on that at this time of year. If you have any questions, concerns, 055 11 11 997, and then shortly I'll activate the phone lines. Okay, so let's say essentially or fundamentally all women are vulnerable.
Yes.
Okay.
Yes.
Are there any other factors other than multiple partners, smoking, use of some of these abrasive, harsh substances in their private areas? Any other factors that may tip the scale and make it more likely that you may get cervical cancer? Before we get quickly to the screening, any other factors that women should be, or profile factors that women and men should be aware of?
Yes. So to add to it, we have those that are HIV, like immunosuppressants.
Right.
Women who are HIV positive.
Okay.
So once you have
HIV or any condition that might compromise your immune system.
And then we
Right.
talk of high parity. So women who have had more than 5, 6, 7, 10 children.
Okay.
This, the cervix, the cells grow and they multiply and
Okay.
align themselves. So once you have that, it says that you are.
What would you
at a
consider
high
high in our part of the world? 3 or more?
So more than 5.
More than
So
5
from
children
5 up,
is
yes.
high.
Because I've met a woman who said she has 14 children.
Oof.
Just last 2 weeks.
Wow.
So
okay.
these things can, open up a woman and a few, maybe the way we bleach and other things. So these
They affect us.
steroids could enter the body and then cause certain things to open up that part of the body to cervical cancer.
Okay. Right. 25 minutes past your hour of 2 on Joy 99.7 FM. Still talking about cervical cancer, cervical cancer awareness, screening, detection, etc. We know there are screening programs all throughout the year. Of course, when it comes to January, we declare a month of awareness and so on and so forth. Screening is important because until it is advanced, cervical or cervical cancer is largely asymptomatic. And I want my guests to talk about that before we go into screening. The reason I'm emphasizing this is that for most people, when we do these discussions on radio, they say, well, there's nothing wrong with me. I'm fine. So they're not talking to me, and I'm not going to go for any screening. Indeed, my reading suggests that Ghana's the prevalence of screening is pretty low. The patronage is still below 3%. I've seen 2.8. I've seen 2 in readings across from way back from 2009, 2010, 2012. The figure remains the same. We are not patronizing these things, despite dedicating a lot of programs, awareness, and education to this. Right. So, Doris, or let me come to Elizabeth. This is largely something that will not do anything to my body whilst it is developing and advancing. Can we speak to the fact that cervical cancer is largely asymptomatic in its early stages?
Yes. as you rightly said, cervical cancer is asymptomatic because when it starts, there's no sign to indicate that you're having a condition till it gets to the advanced stage when you start seeing the bleeding, the discharge from the vagina, which is a little bad, and then the pain.
Right.
That is when it prompts women to come to the hospital.
When you say pain, I like pain to be specified and pinned down. Pain when, where? Pain
around the cervix.
Right.
And then the abdominal pains, the waist pains and other things.
Okay.
Especially the female reproductive area. So that is when they seek care.
Is this pain that is there all the time? Is it pain during intercourse?
Normally, it starts with pain during intercourse.
All right.
And then the bleeding, they start seeing it after intercourse.
Okay.
But that's the early stage.
Right.
That will prompt them to come and
bleeding.
Yes.
Right.
That will prompt them to come and then seek for help.
Okay. Right.
So normally we advise that they should come and seek for help because the early screening helps to detect the virus early. Because cervical cancer is preventable.
Okay.
So the early detection will help us to give appropriate treatment
all right.
to the client or the person that is visiting the clinic.
Okay.
So normally we advise that they visit early. That's why we are now advocating on the screening schedules for women in the country.
Right. Coming to the program of screening, I mean, I read that if all things are good and equal, every 3 to 5 years, depending on your age and your profile and so on, I'm asking you, Doris, how often should I check, right? Because the word is really, the phrase is really routine screening, right? What is routine? And then I read something which was very interesting, a paper by, I think, Adanu, Anafi, and Sefa, right? Which suggests that it is women of higher education, higher social standing, right, that are picked up for when they were referring to the pap smear, right? And even then, their doctors only request the pap smear when they have this irregular bleeding and so on and so forth. And they are not including it, at least at the time of that study, in routine gynecological consultation. In other parts of the world, they actually have established national cervical cancer programs and screening programs where it is routine and mainstreamed. So when we say routine, what do we mean? And can you let my listeners know, do we have a national program now that indicates and mandates screening of women? Because we know this screening is a big, huge determinant of what happens.
Unfortunately, we don't have a national program. Like you are saying, you are talking about other places. We do not. And I know from friends that periodically, when those outside, you are called.
You are even called. You get emails. You get letters in your mail.
For your routine check.
That's right.
So if you have the test done and you're negative, maybe 2 consecutive times, then you are liable or you are ready to have it in the next 3 years or 5 years. And it's also said that we have, there's a global strategy that WHO wants to see across the whole world, where 90% of teenagers up to age 15 should be vaccinated against the virus. And you know, cervical cancer is mostly one of the cancers that is preventable.
That's right.
When you are vaccinated, especially when you catch them young.
And the vaccine is available.
It is available, but very expensive. So then 90% should be vaccinated by age 15.
Right.
Then 70% should be screened. So women who have started having sex and all that should be screened by age 30 or 35 to 45 years. And then 90% again should be treated. So those in that category of where they have the pre-cancer.
Essentially, we are way off.
We are way off.
If I'm talking about 2.82% of women being screened,
we are way off.
As for vaccination, we don't even want to go there.
No.
Right? I think one of the first ladies, was this first lady started a program to push for young girls to be vaccinated against cervical cancer, right? But when it comes to just the screening to check, we are way off target. Despite all this education?
Yes. The screening, this year has been rather better, I would say. I don't have the statistics for the awareness creation. So that, let's say, most of the clinics are, creating awareness. But when it comes to, a routine check where you can just walk into the clinic, we have a few.
Yeah.
Greater Accra Regional Hospital, we started holding it as a program where every day of the year is not only about January, February, where we do screening.
Right.
It's part of our daily work that we do. And a few of the hospitals. So like you're saying, if you go to your gynae, which most women in Ghana will not even do.
Doris, let me chip this in. In the study I'm referring to, the women who had actually had a pap smear, at that time the acetic acid screening wasn't available. That was 2010 or so, right? But the women who had actually, they formed about a little over 2% of the sample who had had a pap smear. The interesting thing is there over 90-something% who had not been screened at all in the period under study had all recently had gynecological consultations. They've been to hospital, all right. They've seen the gynecologist, and nothing whatsoever was mentioned about cervical cancer screening.
So, we are, that's why we are making this awareness. We are creating this awareness.
But it doesn't seem like the policymakers are listening.
No, well, in our part of the world, we are not into the preventive aspect or preventive, way of health. We rather want not that we want, we wait till the condition starts and then we are treating.
That is so frightening.
Which is becoming too much for women.
Of 2,800 women annually, we're losing 1,700, and we are still reticent and lethargic when it comes to the policy that will say do X or do Y, until a foreign party or donor gives us a little money, then suddenly we say we are doing it. I think this is unacceptable, untenable in 2023. And I know the hard work you ladies do and many across the country, but it's simply untenable that in 2023 we don't even have a policy for screening.
No. So let's say I always mention Greater Accra Regional Hospital, where we ladies have really done a lot since 2002.
Yeah,
where we started.
I've been with you.
You've been with us all through, and thank you for that. We try to make, the effort. But let's say I have a few statistics here.
Right.
So 2019.
Let me just announce the phone lines whilst you're, if you're just joining us, we're talking about cervical cancer awareness, know your status. We're looking at the various, should I say, factors. We've understood what cervical cancer is. I keep switching because some people will get up and say you're pronouncing it wrong, right? My orientation is a bit different. I know cervical cancer. Some say cervical cancer, right? Whichever it is, we know it is trouble and it's killing our women, right? And it can be prevented. And if it's detected early, it can be successfully, effectively treated. We haven't even gotten to that yet, all right? 0302-216-541. 0302-216-541. That is my phone number to call. WhatsApp is 055-11-11-997. Very, very serious business. If you see me agitated on Sunday, it's this kind of stuff. Hello, greetings, Honorable Nortey and Ultimate Health Team Panel. Please, I suggest your resource persons do a periodic and intensive outreach education in our schools. Thank you for the awareness. You'll be amazed what you encounter when you start looking for resources and funds for these programs that seem so logical. This one says, belated happy birthday to Pobi Oheniwa Tracy, second year science students of St. Rose's SHS Akwetia from Sir Foster and all of the 2021 Eagle class of Aikuma Methodist Basic School. Another one says, greetings. Okay, I've read that one. All right. WhatsApp is 055-11-11-997. Abeko, I have a caller? Nope. All right. Okay. Yeah. So come back to the stats.
So like I said earlier, we do not have an accurate data when it comes to Ghana, despite the magnitude of this problem we are talking of. So I just put a few. So we put a few things together before the COVID era.
Before COVID, that is for Greater Accra Regional Hospital.
Yes, 2019, we had 2,118 women screened for cervical cancer, and out of that number, we had 18 cancers.
Right.
So someone will say 2118. Why are we making noise when it's only 18? Only 18 is not only because
one case is too
one
many.
One case is a big
for
thing.
Something that other countries are preventing effectively.
So if one woman develops cervical cancer, I mean, it's stage 3 or 4 where nothing can be done.
Yeah.
The whole family is down.
Yeah.
Because the money that will go in and the number of, visits to the hospital and all
mind
that.
you, what you're reading out is just Greater Accra Regional
just
Hospital.
a small clinic you know
Yeah.
of. Then 2020, COVID came in.
Mm-hmm.
Then we did a free screening in
Right.
February
Right.
2020. We saw almost 4,000 women in that small place.
Okay.
That is 3,929 women.
Okay.
For cervical cancer.
Right. All those, just a second, but all of those were covered by the free screening.
Yes.
Okay. Right.
No, parts.
Some of them
not.
were free.
Some of them were
That's
free.
Good. Okay.
I think 1/3 were free. Just a quarter.
But making it
had to
free
do-
also, or subsidizing it,
Yes.
also accounted for the increase in the
Exactly.
numbers. Okay, good.
So in that, we saw that number, and 284 tested positive. Positive does not mean the person has cancer, but then they were
The
treated.
screening was positive.
Yes.
Right.
So they
For
had
abnormal cell group.
precancerous cells.
Okay.
So they were treated, and that is what we are talking about.
Okay.
And 12 out of that had stage of cancers that had to take chemotherapy.
Right.
So they were referred.
Right.
Then 2021. So after that time, COVID came, so
Right.
it stopped.
Okay.
Then we saw almost 2,000 women in 2021. Out of that, we screened 10 women who had cancer.
Right.
Then just last year, things had gone down. We saw almost 1,700 women. And out of that, we screened and had 4 women having cancer.
Okay.
So,
And were they at precancerous levels, or
no, they are cancer.
they had actually
The
reached the cancerous stage?
precancerous stage was just 17.
Okay.
So those numbers, because we could do something about it,
Right.
it wasn't too bad.
Okay. Right, folks. If you just joined us, 39 minutes past the hour of 2. We're talking about cervical cancer. These numbers are live, direct pink sheets from the Greater Accra Regional Hospital. Now, this is preventable if it's detected at the precancerous. It's not malignant yet, right? There are changes in your cells, the cells of your cervix, but there are wonderful things these ladies sitting here can do at their level and sort you out. Capiche? Finish.
Yes.
Right? There are things and interventions that they don't even need a higher level medical personnel to do. Right? And they are able to do that on site and sort you out if this is detected properly. We have even gone into screening, right? And the methods they are using and the program, we'll get there. All right? So this tells us that we can do a lot. For those women who are seeing their gynecologists and so on and so forth, having regular consultations, and this is not mentioned or screened for, we are missing out on a huge opportunity to save lives. That's why I'm speaking so earnestly about this. We are missing out. Indeed, for the study I read, if those women who had consultations but not had any screening, if they all had screening, then the prevalence or the patronage for screening would have gone up almost to about 15 or 17%, right?
Yes.
So you can do the math yourself. Let me read a couple of these. Phone line is 0302216541. You can call. This one says, firstly, somebody's asking, I saw it somewhere. How much does it cost for screening? Can we quickly answer that? Just bam.
Yes, so in Greater Accra Regional Hospital, our reproductive health unit, pap smear, we are doing pap smear. It's just about 150 Ghana cedis. The simple test, VIA, we're still doing VIA, though it is 30 cedis, which we want to do free for the month of February.
Okay.
And the HPV, DNA test goes for almost 400 cedis.
Okay, that's a higher level of testing. All right.
Yes.
Okay. Please, Nortey. Hey, please, Ata Nortey. Can a woman whose womb has been removed suffer from cervical cancer? I'm 75 years and I had it removed in 1995. Akosua in Ablekuma.
So the womb can be removed, but if this part, the cervix is still
So you want
there,
to know whether
she
it's a
can
total
still-
hysterectomy?
Yes. So she needs to go for a check to be sure that her cervix has also been removed.
Okie dokie. My wife had her pap smear last week in our church, but she is yet to be contacted for positive or negative results. How long does it take to get your results? This is Kwame in Dansoman. So his wife had a pap smear, right, last week, waiting for her results. I'm glad the church had undertaken this. He's a bit anxious that she hasn't heard anything yet. Elizabeth.
So it depends on the facility that did the testing.
Okay.
But Ridge Hospital normally takes 2 weeks for the pap smear.
For pap smear.
Yeah, for pap smear.
Okay.
And the VIA is instant.
Right. VIA is the screening using what people call vinegar, acetic acid, right? Good afternoon, Nortey. Please, don't you think the government should fund this? Papa Ansa from Latte Equipim. You know, we've been yelling for this, even the pap smear, to be covered under NHIS. It's not happening yet, okay? And these are things we should be talking about seriously and dispassionately, right? Because we're losing women. Thanks for bringing that up, Papa Ansa from Latte Equipim. Let me see. Hello, I'm M.O. Benjamin, Head of Department of Science, Agona Fankuba, SHS. Greetings to the doctor. I strongly believe that such education must target the second cycle schools. Good job to your team. And again, when our teams go out there, in fact, we have Ultimate Health partnered with some of the teams, Ridge Hospital inclusive, where the funding and all that will determine how many people we can see. I have a caller on the line. Hello, good afternoon.
Hello, good afternoon, sir.
Yes, good afternoon. Who am I speaking to and where are you calling from?
There is Augustine from Old Nigo, Ghana.
Augustine from Old Ningo.
Yes.
All right, go ahead, Augustine, please.
Please, our program is good and they teach a lot. I want to ask the doctor there, how are you going to do? Because I entered the program new. I have not listened to it. So how are you going to feel before you know that you are contact with this disease? And they teach us many things so that that disease will go out of our body. That is my thing.
Okay. Right. He's calling from Augustine from Old Ningo, and he joined us late. So he's asking, would you feel anything, signs and symptoms that would show or indicate or flag that possibly you have cervical cancer? We'll come back to that in a second. We've talked about that already, but he just joined us. It's a first-time listener, so we'll do him the honors. Anybody else on the phone line? Yep. Nope. All right. So just quickly, I mean, would a woman who has cervical cancer be aware of anything?
As we rightly said earlier on, the woman with cervical cancer, even the onset, there is no sign. It's asymptomatic.
Right.
So she will not feel any sign or any pain till it gets to the advanced stage.
Okay.
That is when she starts feeling the lower abdominal pain, the discharge, and then the bleeding after sex, postcoital bleeding.
Right.
That is when the person feels
postmenopausal bleeding.
Yes, at times postmenopausal. Someone who is menopause and then suddenly he has seen blood.
Okay.
So those are the things that will prompt someone to come to the hospital.
Okay.
But normally we advocate on the screening, because when you do the screening, that is when we detect it early and then we help.
I have a caller on the line. I'm going to take that call and let's explain screening, because many people confuse screening tests for diagnostic tests. Indeed, some of the literature says doctors are now using the pap smear as a diagnostic test instead of a screening test. And we'll come back to that. Hello, good afternoon.
Good afternoon, Dr. Nortey.
Hi, who's speaking?
My name is Edem from Lashibi.
Right, Edem, you're most welcome. Share with us.
If you do
Edem, maybe you need to reposition yourself. Try again. Hello? I think her line is suffering from some challenge. Adam, please try and call us again. She was going to ask if you do the test or if you do the screening. Right. So coming back, screening is looking out for something, right? You're just checking, right? What are you looking out for when you do a screening, be it a pap smear, be it the HPV DNA, or the acetic acid? What are you looking for?
So normally when we do the screening, we look for the precancerous lesion.
Okay, what is that?
So that is when the cells
Can you just move your microphone a bit closer? Yeah.
When the cells begins to multiply abnormally.
Right.
So when we do the screening, that is when we see those precancerous lesions.
So you're looking for changes in the cells in that zone.
Area.
All right. Okay.
So normally when we do the screening and then we see the positive signs, at times it's not all the positive signs that will progress to cancer.
Okay.
So some retrogresses on
Right.
its own and then other progresses.
So you may have changes which are not regular, abnormal changes in cells, but they may not be malignant. They may not be cancerous, right? So the screening will tell us if there are changes, and then we may do further checks and further tests to actually ascertain whether it's cancerous and so on and so forth. Yeah, Doris, you wanted to add something.
So to add to it, now we are advocating for HPV DNA testing, which is a higher test.
Right.
So if it is done and you are positive, so we have the type 16, 11, 16,
Right.
6, 11, and then 16 and 8. We have a lot of the
So
viruses.
you have tests that can actually isolate which type of the HPV
Yes.
you have.
And the virulent ones,
Right.
the 16 and 18, which
Right.
causes the cervical cancer.
Okay.
If it is singled out, then you are asked to either do a pap smear or a VIA.
Okay.
So these ones are now coming in, and we are all scaling up.
Right.
So then, VIA is, sensitive.
Right.
So once we apply the acetic acid or, vinegar, then, like Lisbeth is saying, it picks up the cells.
Right.
And you need a trained eye to detect or to know which cells are abnormal.
Okay.
And then, or pap smear specifically will tell you that you are at stage 1 or stage
Right.
whatever of the cancer.
Okay.
So these are the tests that are done.
All right.
And then treatments can start at that stage.
Okay.
But if it is higher, then you need to do other tests.
Okay, great. I have
in
somebody
addition.
waiting on the line. Hello, good afternoon.
Good afternoon. This is Evelyn
Evelyn.
from Lashibi.
Right, share with us, Evelyn.
I want to find out if you do the DNA test and it is negative, how long will it take to do another test?
Okay, so she's talking about the DNA test.
So
Outcome is negative. How long should she wait?
you need to do it in 3 years to 5 years, depending on where you had it done.
Okay.
But then, if it's negative, it means that you have not gotten into contact with any of the viruses.
Okay.
And that is what can open up the leeway, the link for you to have a vaccination.
Right.
But if it is positive, then we want to see what is there.
I'm glad you added that, Doris, because many people think the vaccination is a treatment. It's a preventive,
It's prevention.
right, strategy.
Because after the vaccination, you still have to be screening
You
though.
still
But
be
then
doing
the
screening,
time
yeah.
when you would if you've had the vaccine, the time that you would have to rescreen
Right.
will be longer than someone who has never been vaccinated.
Okay, right.
So
We don't vaccinate somebody who has been exposed to the virus, the target virus.
no, we
right?
need to
So
treat.
a negative test means you have not been exposed, and therefore you are a viable candidate for vaccination. Many people make this mistake thinking you just go, where's the vaccine? Let me take a shot, right? Your status needs to be known and verified.
If you've ever had sex, you need to screen first. before-
Alrighty. Okay, this is not about whether you're a bad person or
No.
not. Okay, you could be married to
We are all
one
having
person.
sex.
Yes, you and who? 0302-216-541. Great stuff. We're learning. Right now, let me ask this, Doris. It's because of my long association with your program at Ridge Hospital, and you know my affinity for Ridge and the reasons. Right, my dad used to work there as a gynecologist, but my late dad. Right, but a couple of years back, there was a very simple telephony-based equipment, right, for visualizing the cervix that you guys needed, right?
The colposcope.
The colposcope
Yeah.
with the software that goes to the phone, and then you can quickly just do,
Yeah.
right? I think at that time it was around $4,000 or $5,000. Do you have those now in place?
We still need other high technological equipment, and we have that one,
You've got
the
it now.
EVA. But there are other ones which we need.
Okay.
The what is the name? We need those ones.
All right. So we still have a shopping list.
Yes.
Okay, we'll see what we can do about that, because they make it very simple in remote settings.
Yeah.
And there's a Center for Cervical Cancer Prevention and Training, the Bato one.
Yes.
They are doing a program
Dr.
training.
Ifa is doing a
Right.
good job.
They are doing middle level training and spreading, the alumni all across the country to do this wonderful work. So we'll see how, Abeku, let's think about that. Maybe we could raise some money to get them some of this equipment, not just for Ridge. But that's great. Okay. How long does it take, this screening? Because when you say free, then the women descend on your unit. I've been there before, right? But you guys do a great job. Elizabeth, how long typically will it take me if I come there? Let's assuming I have a cervix, right? And I come there for screening. What's the procedure? How long? What's my downtime if I left work to come there?
It's a walk-in procedure, so you don't have to go through the OPD to join the long queue.
All right.
So you just walk into
you
the
come to the reproductive health unit.
Greater
Accra.
Or you ask of the family planning unit.
Okay.
So it's a multi-purpose unit, so we do a lot in our unit. So you just walk in and then you ask for the pap smear, the VIA, depending on your age, and then the affordability.
All right.
So we write for you, then we screen and you go.
Okay.
It's just a few minutes, but now that we are doing the free, I think there are lots of people, so you may wait a little.
So it tells us that financial access is a big determinant. If we want to up these numbers, we should be looking at, companies and other, organizations coming in to support, right? Because it makes a big difference to the average Ghanaian woman. What you say is 30 cedis or 40 cedis is a big deal, right?
I
to
don't.
Them, or?
I beg to differ.
Okay.
Because it is once in 3 years or once in 5 years.
Right.
And 150 cedis. Let's say you go to a place where it's a bit higher, even if it's 200 cedis. I think a woman should be able to put down small money.
Let me tell you where I'm coming from.
Okay.
Right. My mom is a retired midwife.
Yes.
I always say reluctantly retired, right? And we had a little facility even at home.
Yeah.
And let's call it Latibia Koshia, Igbe Town, Zongo, Mataeko, Russia. Yes. The women who typically come, even for deliveries, right? If you look at their preparation even for pregnancy, antenatal and so on and so forth. That's why I said that, right?
I know.
Of course, if you position yourself at the Greater Accra, even there, regional hospital, your catchment area, your Nima, your Mamobis and so on and so forth. My mom had an extension of her clinic in Accra, Newtown as well. So when we look at that, that is where the argument for subsidizing it. Okay. Of course, when we say free, it means somebody else is paying. But we must position our advocacy well.
Okay.
Right? Because even before health insurance, I did some work in Birim South, or was it Birim North, where a doctor and a hospital, I've forgotten the name, a facility, they had women who would bring agricultural produce, farm produce, to the hospital to sell. And the proceeds are advance payment for when they are due to deliver. So that was health insurance way before 2004. Right? So we need to look at these creative means of getting women. I mean, if you can even send something to a short code and in a month you have enough money to come for your screening, then you come for your screening. We should get creative and harness some of these financing. The Bato program, they are using crowdfunding, using social media to finance some of the things, and they are purchasing a lot of the things, and they are able to get some subsidized rates for women. That's why I say that. But I agree with you. You are in the field as well. The woman who is spending money on fingernails, eyelashes, waist trainer, belly suspender, compressor, or whatever, bone straight.
So maybe I did not go look at that aspect. So if we're looking at this category of women, I think we should do a lot of awareness. So even if the woman
you think they are not aware,
could afford, some women, you'll be surprised, are in Accra here. They don't even know what it is.
Right.
And there are learned women who know.
They just
somehow,
know that maybe
they don't
they
want
bleed
to
after
know
sex.
Yes, they think that okay, it's better I don't know.
Right.
And if we're talking about the cost, then we look at these two categories: someone who can afford,
right,
and someone who can't afford. And last, I think 2 years or 3 years, you came there and we were talking about this.
Yeah.
Some women truly, for 30 cedis, they cannot afford. Fine, we could look at that. What about those who can afford?
Right.
They are not prepared to. Hey, I'll feel pain.
If it's a funeral, they'll get cloth.
Yes. So that
they'll
is
buy
why
their cloth.
I'm saying that I bet to differ because
great.
some do not have. But if it's a funeral cloth, mama.
Right. So what it means is that when we're doing some of these supported or subsidized programs, we should target it so that those who need it get it. And let me say this to the ladies and the women, indeed the men listening to us. Look, if you have a little disposable income, when you go for your screening, lay down some money for somebody else's screening. Say it's 30 cedis and Agyei, can afford. I've been and I've seen Doris or Elizabeth, but I give them maybe 100 cedis and say, for women after me, who may not be able to afford, I'm putting this in maybe Range Hospital's fund, right? We should start thinking. And men, you can just go and put money down there, okay? These days, side chick troubles are trending. Decrease, give the side chicks a haircut and then go and put the money at Range Hospital or somewhere else and get people screened. Okay, we're almost out of time, but we will go into detail subject to your availability on the actual tests and then the treatments you are able to give at facility level. Because there's a lot of wonderful life-saving stuff you are doing, and you do it like just all in a day's work, right? But we need to talk about that. Before anything major like chemotherapy and all those things, there are things you people are doing at your level. Yeah, we don't want to get there.
So February, we've laid it down to do just the VI. So as the women come in, we are just encouraging women. It started on the 1st of February.
Right.
But people are waiting for the end of the month and they come and crowd it. It's open from Monday to Friday.
Right.
From 8 a.m. 2 p.m. we are done with the screening.
Okay.
And that is for women between the ages of 25 and 44.
All right.
Around 45, then you have it free. But after that age, you need to pay 150 cedis.
Right.
If you are less than 25, let's say 21 years to 24, and you are sexually active, you need to pay 150 for the pap smear or HPV, whatever. So when you come in, it's not just about free, but then we would encourage you, counsel you, and do it. And through that, we see other gynecological issues, and women are helped.
Okay. Now, what would you say to churches that may be interested? Or organizations or workplaces that want you?
We are
you able to do outreach?
We are not many, but we try to do outreach. At least 2 people can go out there. So any organization who wants their women, so they are like, we don't want to come to the facility. We need you to come to our place. You negotiate and know what to pay and what to do, and we are able to do it for you.
Okay. All right. Great stuff. Elizabeth and Doris, we thank you immensely, and we hope we'll get you next week. Then we'll go into what a pap smear is, what the VI is, what the HPV DNA is, and then all your cryotherapy and the other things that you do as treatment modalities. I hope the ladies have been informed and transformed, and the gentlemen, because you may be harboring, you may be carrying this HPV virus, having fun all around. You are asymptomatic, but you're putting some woman in trouble. So let's check these things. Thanks once again for enriching our Sunday. Thanks to my producer, Abeku Sankofi. And my name is Nortey by nature. I'm here every Sunday. I don't have anywhere to go. But maybe they might give me a haircut soon. Up next, interesting. It's the month of love. Things are happening here. And the Joy Pop Quiz, Family Pop Quiz has its, love edition. You are the one.